Downtown Neighbors. Join us from the Center for Family Health, Chief Medical Officer Dr. Rose Johnson and Clinic Manager Tracy VanBuskirk. Welcome.
Good morning.
Good morning.
Good morning.
Welcome back.
Well, thanks for having us.
It's flu season, and I know that because I got a flu shot yesterday.
He's been complaining about his arm the whole day.
Well, I can't believe I can't hold anything. It's just
It's not that bad.
no, it's not.
No, it's not.
Is
I'm
now-
exaggerating.
Yeah, you are. So now must be a good time to get a flu shot.
Yes, absolutely. Yep.
Yeah, so we recommend, the CDC also recommends flu shots for anybody above the age of 6 months.
Okay.
And we want everybody to get it. It helps save lives. It helps protect people from severe cases of the flu.
Who's most at risk for flu or for severe flu?
So older people and also people who have other health conditions that can make them less able to fight the flu. So the immunocompromised are at higher risk of getting a severe case of flu.
Now, someone like me, over the age of 65, there's a higher power flu shot for older folks. Is that right?
Yes. There's different kinds of flu shots, and yes, it is recommended that older people do get the stronger, higher dose of flu that's available now.
Now,
Yep.
Tracy, you guys offer the vaccine. Do you need to make an appointment? Is there a cost or anything?
For the COVID vaccine, there's no charge at all.
Okay.
But for the flu vaccine, for children under the age of 19, there's not a cost for that either. Most insurances cover the flu because it's so important. If you don't have insurance, we have a department that can assist you in, getting your needs met so you can get the flu because it's super important.
Yeah. Do a lot of kids get flu shots?
Yes,
Yeah.
they do. They definitely get a lot of flu shots because flu can move pretty quickly through a family.
Yes.
And so that it's definitely, especially the little ones, to get them vaccinated.
I'm wondering because everyone's been so kind of protective over the last few years. We haven't seen as much flu. Are you guys worried that this is going to be the year of the flu?
I think we have to definitely watch for it. We actually saw flu even during the summer seasons,
Really?
which is not usual. But I think you're right because we haven't seen as much the past 2 years. We're expecting this to be a severe one. Yes.
Yeah, so the first year of COVID, no flu.
Right.
And we're assuming that it's all the precautions we took with the masks, the hand washing, the social distancing. If we were to continue that behavior, does that increase chances that we'll be flu-free this season?
I think it'll help decrease the number of flu cases we'll see. I don't think we can be flu-free, though. I think we will have that.
I think more parents are holding their kids home from school, obviously, since the pandemic changed everything. Not maybe forcing kids to go to school if they're a little under the weather, and I know people at work, they are taking sick days more so
Yeah.
hopefully that does help. Can you get a COVID and flu shot at the same time?
Yes, we can definitely do both COVID and flu at the same time. We tend to do it in 2 different arms, but yes, we can.
How about for people that can't come during the normal daytime clinic hours, are there any evening appointments available?
Yeah, Monday through Friday we do have evening appointments available. They just call our main number and we can get that scheduled. And we of course have walk-in Monday through Friday 9 to 5 in our second floor clinic as well.
That's awesome.
And we are able to get these at, I think, 2 locations now? Parkside too?
Parkside does have flu vaccines as well. But we kind of, we have more, we can accommodate more volume down at our downtown office. So if possible, we would like to see them down there.
Yeah, plenty of free parking.
Plenty of free parking, beautiful building. That's got to be nice for all of the patients and visitors too, coming into this world-class facility that's constantly growing. It's awesome in there.
Yes. Thank you. We think we do like it very much.
Yeah.
So for people 65, the obvious reason we want to protect older people is they're more vulnerable to have complications but other than that age group, are there other populations that are more vulnerable that really should get the flu vaccine?
So we recommend it, like I said, for anybody. But of course, if you have other health conditions, diabetes, for example, would be somebody we would say absolutely has to get it. COPD, asthma puts people at increased risk of a severe case of the flu. So those are examples, and there are others. Heart conditions also. So almost any other medical condition that somebody has will put them at an increased risk for a severe case of flu.
I should tell my mom watching in North Carolina, you should get the flu shot this week, Mom.
If it came with a bag of peanuts, I'm sure she would do it.
Jelly beans.
Jelly beans, peanuts, or Diet Coke. And, yeah, for sure.
Still, people are able, as we're back to school, to get school physicals, back to school checkups, back to school immunizations. They're still trickling in, aren't they?
Yeah.
Yes. Definitely.
Yeah, we are seeing physical exams. We are also seeing younger kids come in so that they can get their immunizations. All people are trying to come in to catch up on what they haven't in the past 2 years.
Yeah. Well, I hope no one comes in to see you guys after taking the one chip challenge. I've warned you both. And I hope you look on YouTube at some time later today and see what this has been doing to people. But it's been banned at a lot of schools, so don't eat it. That's our warning. That's our warning.
So you've seen some flu cases already this summer. What's the flu like this year? Is it a bad version of it?
We have not seen any severe case yet, but again, the flu season is actually just beginning, honestly, and we start seeing it now. We see it throughout this year. We'll see it in January and February, so it's hard to say what exactly it's going to be this year. We are nervous about it being a severe season, though.
All right. Well, thanks for coming in today and taking great care of our community.
Thank you, guys.
Yes,
Thank you for having us.
Dr. Rose Johnson, Chief Medical Officer at the Center for Family Health, and Tracy VanBuskirk is Clinic Manager at CFH, leading the community to healthcare for all for more than 30 years. Up next on the Morning